Since the onset of the COVID-19 pandemic, the Filipino people have been faced with unprecedented challenges.
We have been hit by many disasters and crises in the past, and we have always shown our resilience and determination to recover as one nation. Yet, nothing has prepared us for COVID-19 and its impacts.
Schools were closed, economic activities were limited, and non-essential travel and movement was not allowed in order to slow the spread of the disease.
Given the huge task ahead of us, a lot of LGUs may be asking, how do we even begin?
Taking the lead in the management and control of COVID-19 outbreak, the local government units or LGUs face new challenges, requiring swift and innovative solutions to respond to the needs of their communities. With limitations to mobility, many Filipinos found it difficult to consult doctors and healthcare workers. In order to address these concerns, the local government of Taguig City launched its own telemedicine hospital program.
Taguig City is the first LGU to implement the telemedicine. This was implemented during the lockdown on March 2020. Telemedicine is a remote diagnosis and treatment of the patient through telecommunication, implemented for the safety of the patient as well as our health workers during the time of COVID pandemic.
Through innovating and maximizing the network of health centers and services of barangay health workers, Taguig City continued to provide medical services, allowing the residents to seek medical assistance from the safety of their home.
Telemedicine have helped a lot in reaching out our constituents who could not have a checkup during the time of pandemic.
The early days of the pandemic and even months after also saw the loss of jobs and income among Filipino households. The Philippine government initiated a financial assistance program under the Bayanihan to Heal as One Act. With the government funding in place, the next challenge is disbursing financial aid to millions of beneficiaries. In the province of Sultan Kudarat, the city of Tacurong sped up the disbursement through a combination of new technology and administrative efficiency.
Dahil po sa CBMS namin po, we have distributed food packs immediately, no? Kasi identified na namin sila kung saan sila area. So, mas mabilis yung pagbigay namin ng ayuda sa mga less fortunate members of our people here in Tacurong. Lahat na LGU siguro maggawa ng ganitong program, no? Kasi kailangan natin talaga ma-identify yung poorest of the poor natin dito.
As days turned into weeks and into months, it became clear that the effects of the pandemic on people's livelihoods would be felt long-term. Even with the various social protection programs in place, LGUs had to devise ways to provide jobs or income-generating opportunities for their constituents. To provide local families with an alternative source of income, the local government of Binyan City in Laguna piloted the Mask Ligtas program.
This is a program of the Gender and Development Office in line with our pandemic situation. Since there is a surge of demand, the lack of supply of face masks. That misfortune gave us an opportunity to think of a project that we can use and be useful in the Women's Month.
Not only did the face mask program provide jobs within the community, it also helped augment the LGU's supply of face masks for households and frontliners.
When the national government declared a complete lockdown, this became a continuous livelihood project for the sewers that we have found in the 24 barangays of Binyan. When we were asked to continue our project, we were able to produce face masks to give at least 2 for every household from the start of the lockdown.
These initiatives, among many others, show the capacity of local governments to effectively develop innovative solutions to create an impact in the lives of their constituents.
By proactively identifying and putting in place plans, systems, processes, financing options, and personnel before the disasters and pandemic hit, the local governments would not be caught off guard. The road to recovery and ensuring resiliency from disasters and pandemics may seem like a daunting task. But when you plan ahead, when you have a roadmap, when you anticipate what you needed to do, you would have clear goals and objectives. You will give your communities and your people a head start in regaining what they have lost, protecting what they still have, bringing back normalcy, and ensuring that they can face tomorrow with hope and optimism.
While our challenges seem overwhelming, we will continue to find innovative, timely, and responsive solutions as more people get vaccinated and our economy gradually reopens. The LGU Guide for Rehabilitation and Recovery from COVID-19 is a comprehensive tool that our local chief executives can use in leading our communities towards full recovery. This guide will enable us to bounce back stronger and adapt better towards the new normal. Together, we can heal and recover as one community and as one resilient Filipino nation.